Hi, my name is Z Neuckermans. Welcome to this video abstract about diagnosis of upper respiratory tract disorder in horses using a cheap, flexible and steerable borescope. My co-authors and I are all from the Department of Large Animal Internal Medicine of Ghent University. Respiratory tract disorder are commonly seen in horses, and endoscopy would be the preferred diagnostic technique for the evaluation of upper respiratory tract in horses. However, this material can be fragile, also of substantial size, but even more expensive and therefore not always available for field practitioners. So we went to look if there was something else that could be useful in certain situations where endoscopy was not available. This would be by the means of a borescope, which is an industrial endoscope without the medical label and usually used for the inspection of pipe and motors. Depending on the model, you have models which is possible to steer in 4 directions, in 2 directions, with or without the biopsy channel, smartphone connected, tablet connected, etc., etc. The price can vary and can be 10 to 100 times cheaper than an endoscope. Our aims in this study were to visualize the different upper respiratory tract structures in horses and subsequently to establish a diagnosis. To do this, we used this particular model of borescope that we chose. It was a cheap borescope, about 200 euros. It was waterproof, steerable in 2 directions. It contained 6 LED slides and the head was flexible in 180 degrees in both directions. We did cover the borescope with this orange rubber tube because it had a rib part that we were afraid it could be a bit traumatic. We ended up scoping 100 horses, first with this borescope and then secondly with the endoscope, and we compared the images by a blinded observer. As you can see here with the image all taken from the borescope, we could visualize all structure of the upper respiratory tract. We also give different scores. Here you can see the same horses with pharyngeal lymphoid hypoplasia, grade 4. This was taken with the borescope and this one with the endoscope, and we did the same for the 100 horses. We also score recurrent laryngeal neuropathy and mucus tracheal scores. Abnormalities were noted in 63 horses and different diagnoses were made, including the pharyngeal lymphoid hypoplasia, recurrent laryngeal neuropathy, intermittent displacement of the soft palate, petechiae of the pharynx roof, mucus, or alimentary content in the trachea. In conclusion, we can say that this really simple, cheap borescope was allowed us first to visualize different parts of the upper respiratory tract in horses, but also that the image were good enough and the quality was good enough to make diagnosis of different disorders. This tool is accessible financially and practically for field practitioner, but also useful in certain situations where there would be a financial constraint, or even can be used as a backup device in a clinic. We had no source of funding nor competing interest, and the study was approved by the Animal Ethics Committee of Ghent University. All horses were client-owned horses and informed consent was obtained. Thank you for watching.